Greetings everyone, my name is Captain Matthew Grittis and I am here on the behalf of the Uniformed Services University Graduate School of Nursing Class of 2024. Today I would like to take a few minutes of your time to present the Travis Air Force Base Registered Nurse Anesthesia Cohort Evidence-Based Practice Project titled The Importance of Staff and Patient Education on Unplanned Pregnancy After the Use of Sugammadex and Aprepitant. Sugammadex and Aprepitant are two medications commonly used in anesthesia that both have drug-drug interactions with hormonal birth control. Currently, there is no standardized practice for patient discharge education after receiving those medications. We found that the perioperative staff are not familiar with these interactions despite being the ones responsible for discharging patients home. 90% of female service members are of childbearing age, and oral contraceptives are the most common form of birth control for service members. With this information in mind, we developed the following PICO question. Among women of childbearing age undergoing surgery at David Grant Medical Center who received either Sugammadex or Aprepitant, how does a perioperative staff education implementation project combined with patient discharge handouts compared to the current unstandardized practice of verbal counseling increase awareness in the potential for an unplanned pregnancy? To address this, we implemented a number of new processes, including a perioperative staff educational PowerPoint, a patient discharge handout with drug-drug interactions, an update to the anesthesia PACU handoff report sheet, and finally a pre- and post-test to analyze the results of our intervention. We found that the knowledge of Sugammadex's mechanism of action and drug-drug interactions increased 30%. Additionally, knowledge of Aprepitant's mechanism of action and drug-drug interactions increased 22%. Staff who answered as always educating their patients on Sugammadex interactions increased 62%, and staff who answered as always educating patients on Aprepitant's interactions increased 44%. Overall, we found that all staff improved both knowledge and incidence of patient teaching after our education and intervention. Our recommendations for project improvement would be to provide both generic and brand names for these medications, and to utilize an online survey method for ease of data collection. Our organizational impact include improving staff education on drug-drug interactions between commonly used medications, and increased occurrence of patient discharge education. Additionally, potentially preventing unplanned pregnancies in females on hormonal birth control. Thank you for taking the time to listen to our presentation. We hope that our project will have a positive impact on women of childbearing age at David Grant Medical Center and possibly the DHA as a whole.